Hi, my name is Dr. Salil Khandwala, and I am the medical director and a urogynecologist at Advanced Urogynecology of Michigan. This is our website, www.augm.org. Today, we're going to talk about this big problem that all of us face sometime or the other, constipation. Has a global prevalence rate of 15%. So essentially 1 in 6 people have this. It is an indication for estimated 5.7 million ambulatory visits a year and is the primary reason in 2.7 million of those visits. In the elderly, this constipation prevalence is 1 in 4 or 1 in 3 of them, and women have 2 times to 3 times greater risk than men. Daily laxative use are reported by about 1 in 10 of community dwelling older adults and half of the nursing home residents. And it has a serious negative effect on the quality of life, with patients with constipation have increased prevalence of depression, anxiety, and social dysfunction. I mean, they're constantly feeling bloated. They just don't feel normal. Not having a bowel movement, they feel sick. They don't feel like leaving the house. They're going back and forth to the toilet, dry runs, nothing is coming out. Very frustrating. Constipation also results in significant expenditure of over-the-counter remedies, herbal remedies, and dietary supplements. Millions more are spent on prescription medications and direct medical care. Physician expenses alone result in healthcare costs exceeding $235 million per year. So that is the major impact constipation has on our society. So let us understand, what is it? What's going on? So as the small bowel comes around, it opens up into the large bowel. You have the ascending colon where the stools are getting formed, the transverse colon where the stools are being transported, and the descending colon where it's coming down until the rectal ampulla or the trumpet where they sort of hang around here. So the motility is going down, it's being pushed down, except for the rectum, where the anal sphincter, which is nicely controlling the inside one and the external one, which are holding the anal canal intact and preventing the stools from coming out. It also has a sphincter that's called the puborectalis sling that draws this angle forward, maintaining, bowel continence. Now, when the stools are moving down, there's something called high amplitude propagating contractions. High amplitude propagating contractions, or HAPC, as you can see right here. So when they happen, they occur about 6 times, on average 6 times a day. And these predominantly, they start in the cecum and they move up, and they're responsible basically for movement of the colon. So how it comes down this way on the HAPC. Constipation is divided into 3 types. The most common is this normal transit constipation, then there's dyssynergic defecation, and slow transit constipation. The normal transit is defined by the Rome 4 criteria. Usually the symptoms have been worsening for past 3 months, ongoing for about 6 months, and 2 or more of the following criteria have to be met to be considered that, like straining during over 25% of bowel movements. And then I'll talk to you about Bristol score type. Well, let me show you. Yeah, I'll show you in a second. Bristol score, it's almost like pebble-like stools in about 25% of the cases. Sensation of incomplete evacuation, and sensation like manual maneuver to facilitate it, like digital pressing on the vagina or the rectum, or in fact putting a finger in the rectum to pull out the stools, and less than 3 spontaneous bowel movements per week. So what's the workup? This is what I was talking about, the Bristol score type 1, type 2, which is like pebbles and extremely hard stools. You don't want to be anywhere here. Ideally, we want to be in this type 4 range. So the testing that we do for this is anorectal manometry, done in the left lateral position. So we have you do some preps, avoid caffeine, take an enema, and then we do some tests when you come in. And it records the sphincter muscle at rest and squeeze and how much you're holding, and also how does that sphincter muscle behave when we're asking you to push out. Now, this is a very important test for our constipation. Can you expel this 50 cc balloon? We try to put the water in this balloon, and until you feel a sensation of fullness or until it reaches 50 cc's, we still leave you in the left lateral position and see if you can take it out. And if not, we'll move you to the commode and have you poop it out. And this is just a special commode chair that we have in our office room. And typically it should be less than 60 seconds to poop out this balloon filled with water. The other test that is done is a radio marker test, which you take by mouth and you see how much is left behind. So that if a lot is left behind, that tells me that, it's not emptying very well. How do we manage it? A lot of things can be done for constipation management, from laxatives to certain specific medications, and eventually even a colostomy. How do we manage how do we do it in our office? We ask all our patients, especially the elderly, about constipation. We review the patient's medication list because there's so many medications that could be causing this constipation problem. We perform special tests to understand the cause, and we then start the correct treatment, and we periodically check for any underlying medical cause. It's a major healthcare burden. Diagnosis is important. Most of the medications for normal transit constipation are safe, and most constipation are functional, so without any underlying cause, and should improve with proper medical therapy. So this is what's going on right now. We can get you to this stage as long as we follow through with you and make sure that we know exactly what medications you're taking and you follow the course with us. If you would like to become a patient, please click on the link below called Become a Patient. If you would like to know more about our technique for this condition, please click on Access to a Medical Library. We'll tell you about constipation management and also about the other conditions. Please feel free to share this with your friends and family on the link by copying and sharing this link called Constipation: Time to Break Through the Glass Ceiling. So let us get all women relieved, one woman at a time. Take care.